Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine again. Welcome to our series for parents. Today we're going to talk about eczema or atopic dermatitis. Remember that this series is not intended for replacing visits to your doctor. If your child has, you think, eczema or atopic dermatitis, I do recommend you discuss this with your physician. We're more than happy to see you here in our office. Same day if you need it. Give us a call here, 775-359-7111. We'll be happy to see you. So what is eczema and what do you guys need to know about this very common disease that we see so much here in the desert? Well, eczema really is a wastebasket of a whole bunch of diagnoses. In dermatology, the doctors like to try to split these up a little bit clearer so that we really know what we're dealing with. And to a point, I'm kind of a purist, so we try to do that too. Most eczema is atopic dermatitis. Sometimes it's contact dermatitis, sometimes it's seborrheic dermatitis. In the end, it probably doesn't matter how specific your doctor is because we treat them all the same. Okay, so what do we see? How do we diagnose this first? Well, the first thing with most eczema and with most seborrheic dermatitis, you have dry skin. With the seborrhea, sometimes the skin is a little greasy, but it's still underneath that dry. It's a kind of a bizarre response to dry skin. Your body oversecretes grease, but still doesn't manage to hydrate the skin well. In the case of atopic dermatitis, the skin starts really dry. As it starts to break down, it can get infected, or you become sensitized to things in your environment, either foods or soaps or other environmental allergens, and then your skin becomes allergic, and that then breaks the skin down further, and it becomes a vicious cycle. How we treat this is kind of a three-pronged approach. If there is infection, it must be treated, and it must be treated with antibiotics. If it's localized, we can use topical antibiotics. If it's throughout the body or large patches, we use oral antibiotics. Step number one. Step number two, and this is the most critical step and the one that parents seem to have the most difficulty with. You must rehydrate the skin. Now there's a number of ways to rehydrate the skin. The thing that works the best is plain old Vaseline, and I don't mean Vaseline sensitive skin, Vaseline lotion, just plain old grease, Vaseline. If you don't like Vaseline, Crisco works very well, but use the unflavored Crisco. And Crisco rubs in nicely. If you don't like that, my Italian relatives always recommended olive oil. It works the same way. I don't recommend baby oil. Baby oil has perfume in it. However, baby oil has a very close cousin, mineral oil. Baby oil is mineral oil plus perfume. Use the mineral oil. It's cheaper and works just as well. The only problem with the mineral oil is it's runny and tends to puddle on the floor, and that creates its own issues because it's kind of a slipping hazard. But whatever you're using needs to go on the skin at least 4 times a day. If it's on the face and you're finding the Vaseline too greasy, then something like Eucerin or Aquaphor, and I prefer Aquaphor, the cream, not the lotion, works well. But again, it's got to be 4 times a day or more. Less than 4 times a day, this is not getting better, especially living in the desert, especially here in the mountains in the rain shadow of the Sierra Nevada mountains. 4 times a day is a bare minimum, especially in the winter. If your child has been swimming in a public pool or swimming or exposed to water, especially if they're in chlorinated water, you got to rinse that chlorine off and grease them up immediately while their skin is still wet. After a bath, same thing, grease them up immediately while their skin is wet. Do be careful. Remember, oil and water don't mix, and they're very, very slippery when you do this. We don't want to drop your baby. For the areas that are red, itchy, scratching, then we need topical steroids. And there's a number of topical steroids we can use. We start with the lowest potency and gradually, slowly increase those steroids. But the goal is to use as little steroid as possible because there is side effect from this. Remember, you can minimize the amount of topical steroid we use by using lots and lots and lots of Vaseline. But you have to be committed to the Vaseline or it's never going to get better. If you have itchy, flaky scalp, there are steroids we can put on the scalp as well that'll come in liquid or foam forms. If your child has really bad cradle cap or seborrhea to go with this, Head & Shoulders shampoo or Selsun Blue shampoo works to help get rid of this, and you can use this even on a newborn. Now, Head & Shoulders shampoo tends to work a little better, but the smells a little bit better, but it's not quite as potent as Selsun Blue. Selsun Blue works a little bit better, but it smells awful. So I personally recommend starting with the Head and Shoulders. Use a generic store brand version of that. And if that doesn't work, then bite the bullet and use the Selsun Blue. It will work, but it stinks. This is a potential lifelong problem. As you get older, the kid's skin does get better and does get tougher. But if you don't let this heal, it's never going to get better. Do you need to test your kids for allergies? Most of the time, no. Most of the time, if we treat the skin, the problem gets better. If the kids don't get better, that's time for allergy testing. Unfortunately, that involves lots of skin pokes. And if you are allergic to things, often desensitization shots and whatnot. And we try to avoid that if we can. And the reality is, here in the desert, most kids don't need that. There are a handful who do. And when they don't respond like they're supposed to treatment, that's when we do the allergy testing as well. But if you learn anything from this discussion here today, it's the grease. Gotta use the grease, and it's gotta stay on forever. The steroids are just as needed. The grease is every single day. It's your preventer, and it's 4 times a day. And yeah, that's a pain in the neck, but it keeps your kids from scratching and bleeding. I hope this helps. I hope your kids don't have eczema. Living here in the desert, it's everywhere, and it's miserable, and the kids scratch and they itch and they don't sleep, and my heart goes out to them. But if your kids do have this, hopefully this will help you get rid of some of the symptoms for you. I'm Dr. Windisch. If I can help you, give us a call at our office, 359-7111. I'd be more than happy to see you here. And in the meantime, we'll see you next time.